Good evening, everyone. Welcome to today's HELP program. HELP is Human Rights, Ethics, Law and Psychiatry. We have started this program from past 3-4 months, wherein mental health experts and legal professionals all come together to discuss on some of the aspects of the HELP, that is Human Rights, Ethics, Law and Psychiatry. In today's program, we have Dr. Bhavika Vajawat, who is Senior Resident in Psychiatry in Forensic Psychiatry at NIMHANS, who will be talking on mental health care, that is Central Mental Health Authority Regulations of 2020. As you are all aware, in 2017, Mental Health Care Act came into picture, repealing the earlier Act of Mental Health Act 1987. Once Mental Health Care Act has come up, then Central Mental Health Authority was established, and they had to come up with regulations on many aspects which are mentioned. So Dr. Bhavika would be presenting on these aspects today. To chair this session, we have with us Professor Suresh Baramat, who is a professor in psychiatry at NIMHANS, who also heads Telemedicine Center, Forensic Psychiatry, and Unit 5 of NIMHANS. He's also consultant at Community Psychiatry Center at NIMHANS. So welcome both Dr. Bhavika and Dr. Suresh sir.
Yeah, hi everyone. Thank you, Chetan, for your introduction. Friends, today we'll be presenting the Central Mental Authority Regulations, which was recently released on December 20th in 2020. So we'll be discussing that and also minimum norms. And Dr. Bhavika will be presenting it, and we will take the questions and we'll try to understand and interpret what is those minimum norms means. Okay, over to you, Dr. Bhavika.
Thank you, sir. Good evening, everyone. I'm Dr. Bhavika Vajawat, Senior Resident in Psychiatry. Today, we'll be discussing about the Central Mental Health Authority regulations. The chairperson for today is Dr. Suresh Baramat, who is a professor in psychiatry at NIMHANS. To give the precedent of the current regulation, so in 2017, the Mental Health Care Act 2017 gave the power to the central authority to make regulations under Section 122. And 3 years after that, on 18 December 2020, the Central Mental Health Authority regulations, also known as the Mental Health Care Regulations, were released. So this is the layout of the mental health regulations. We have 6 chapters, which are the preliminary, advanced directive, mental health authority, minimum standard of facilities and registration of mental health establishments, meetings of the board, psychosurgery and restraints. It also provides the schedule of minimum standards for registration of the mental health establishment. 12 standards have been provided, and there are also 5 forms included. Chapter 1 is preliminary. It mentions that these regulations shall come into force on the date of their publication in the official gazette, that is 18 December 2020. And the words and expressions that are used in the regulations, but which are not defined in the regulations, but which are defined in the Act, shall have the same meaning as that assigned in the Act. Chapter 2 deals with advance directive. So the requisition for writing an advance directive, be it formation of a new directive, cancellation, or alteration of an advance directive, all these requisitions need to be made to the board with Form A, and this should be registered with the board free of cost. And this Form A should be made available in all mental health establishments free of cost. The nominated representative's willingness should be obtained, and 2 witnesses must attest this Form A. And change in advance directive cannot be applied within 3 months of its issue. Previous advance directive will become null and void on registration of a fresh advance directive. And if the nominated representative wishes to withdraw his consent from being a nominated representative, then he needs to do the following: apply to the board in writing about the same, and give it in writing in 3 months notice period to the person from whom the withdrawal of the representation is being done. This is the Form A. I've highlighted some important aspects in this. So, as I mentioned, it is a form used for making, amending, revoking, or cancelling the advance directive. And a registration number would be provided for the advance directive. And in this, the person might mention the way he wishes to be cared, the way he does not wish to be cared, and specify any history of allergies or known side effects. Also, it provides for the nominated representatives to be listed, and the order of precedence will hold good. So as many as the person wants, he can appoint the nominated representatives, and this has to be attested by 2 witnesses. Chapter 3 is on Central Mental Health Authority. So the appointment of the employees would be as per the recruitment rules made by the central government, and the chairperson shall be assisted by the chief executive officer in discharging the duties. Now, the meetings of the Central Mental Health Authority would be held in New Delhi. However, the chairperson may decide any other place if required, and the members may even log in through video conference. Proceedings of the meeting would be recorded as minutes of meeting, and these would be included. This would also include people who have been absent for the meeting. The names of those individuals would be mentioned, and authority shall meet at least twice in a year. However, the chairperson may call for special meetings as and when required. Chapter 4 talks about minimum standard of facilities and registration of the mental health establishment. So, as I mentioned earlier, the minimum standards of the facilities are provided in 12 schedules, which I'll be describing subsequently. Now, it is also mandatory that the mental health establishment maintains records. So, as per the Form B, these records need to be maintained, and the authority may call for any of these medical records on receipt of any complaint. And these records should be maintained for a period in accordance with the law in force at that time. Now, application by the mental health establishment for the permanent registration needs to be done in Form C with a fee of rupees 25,000, or as may be specified by the central authority from time to time. And the details of compliance and documentary proof about the compliance to the minimum standards should be provided while submitting the Form C. These minimum standards will be described subsequently. And objection against grant of permanent registration is provided in Form D. So this is the Form B. It has various aspects. So the first aspect is the basic medical record of all outpatients. And it also requires that the mental health establishment reports whether an advance directive was made available, was present or not. The second part is the basic mental health records from an inpatient setup. Third thing is when a person is having basic psychological assessment reports. So the facilities where persons with mental illness undergo psychological assessment, which basically describes the socio-demographic details, then the reason for referral, be it IQ assessment, SLD assessment, neuropsychological assessment, personality assessment, or psychopathology assessment. Next is basic minimum standard guidelines for recording of therapy sessions. So they have prescribed a format in which the therapy sessions and the notes need to be documented. Then the Form C, that is for permanent registration. So it provides that, again, the mental health establishment would have to give the basic details. And in case the registration was under the Clinical Establishments Registration and Regulation Act 2010, or any other law, such registration number with a copy of the registration certificate has to be enclosed. Also, the application involves the services that are provided by the MHC and the staff which is available at the MHC. Next, filing of objections against the permit of registration to the central mental health establishment. So this is provided in Form D. So this basically mentions about why a mental health establishment does not fulfill why it is being there's an objection for granting a permanent registration. So what criteria it does not fulfill need to be mentioned in the Form D by the board. Next, we move on to Chapter 5, which is meetings of the board. So the Mental Health Review Board would meet once monthly or more frequently if required. And there has to be a 5 days of notice period for such meetings. Quorum of the meeting, that is the minimum number of members required for the meeting, would be 3, including its chairperson. And board would have to revert for any complaint or inquiry made or any request made to the board within 3 days relating to any medical treatment being received by a person with mental illness, and in the absence of which the mental health professional may continue treatment after taking consent from the nominated representative if he is available. Now, a decision of the board shall not make a mental health professional liable to civil or criminal proceedings unless the board, after inquiry in this record, finds out that the mental health professional had a malified intention, or he did not provide reasonable care, or what he provided was a care that he provided was illegal. And the board will follow the principles of natural justice. That is, it will hear to the people involved and it will be unbiased. Next is Chapter 6. It is on psychosurgery and restraints. The requirements for a psychosurgery are that the application has to be made by the treating psychiatrist to the board, and a written informed consent needs to be signed by the patient. A clinical summary and justification of the need of the surgery has to be mentioned with relevant medical records. Now, it also mentions about restraints, and it says that the staff needs to be trained to use alternate methods to provide restraints. So restraints should be a measure of last resort. It should be absolutely minimum in use. And the mental health professional has to discuss about alternate forms of like verbal de-escalation, etc., with the nominated representative or the person with mental illness, and has to submit monthly report of the restraints in Form E, which has to be signed by the in charge of the mental health establishment. This is the Form E, which mentions the indication of the physical restraint, also requires the informed consent of the nominated representative and the signature of the nominated representative. And if this has not been done, then the reason has to be mentioned as to why the informed consent of the nominated representative was not obtained. It also mentions about the dose, frequency of medications, any side effects, or and the total dose that was given. Apart from the physical restraint, if any chemical restraint was given, then even that has to be included in this form. Now, the schedule for the minimum standards of registration for mental health establishment basically has 3 provisions. That is the physiological needs of the person with mental illness, that relates to food, water, shelter, and clothing. Safety needs like security, resources, and hygiene, and esteem needs like non-discrimination, respect, and autonomy. So the first standard is the talks about how the premise of the mental health establishment should be. It should be a pakka structure. Wire meshes for doors and windows should be available to prevent self-harm attempts. Sufficient illumination and natural light should be there. And this should be available even after sunset for reading. Then a lift with power backup for a building with more than 4 floors. Illuminated passages leading to toilets and emergency exits. In general, should have a power backup. Periodic maintenance of the mental health establishment. Heaters and coolers subject to safety and health. Standard 2 is describes the living conditions of the mental health establishment. So there should be separate cots, mattresses, pillows, and blankets for each patient. Sufficient space should be there between each bed. Residents should not be made to sleep on floor. Hygiene should be maintained. There should be adequate number of fans. Standard 3 describes hygiene, cleanliness, and sanitation. So there has to be daily sweeping, mopping, and dusting. Sanitation of all the areas. Toilets should be in adequate numbers, separate for male and female. Disposal facility for sanitary napkins, and clean using disinfectants. Adequate availability of water should be there, and periodic fumigation and pest control should be done. It also includes cleaning and changing the linen regularly, laundry service in-house or it has to be outsourced. So there has to be a separate washing area and adequate manpower, and adequate arrangements for safe disposal of biomedical waste. Standard 4 talks about wholesome, sumptuous, and nutritive food and potable drinking water. So food should be served in a respectable manner, hygienic, nutritious, at frequent intervals. Special diets should be made available for special populations like the geriatric population, children, pregnant women, lactating women. And dietitians should prepare meal charts to meet the special requirements. Cooks should have mandatory health checkups periodically, should wear an apron, masks, and headgears. Standard 5 talks about facilities for social, cultural, leisure, and recreational activities. So there has to be entertainment programs, socials, and excursions for the inpatients. Visitors' room for families coming to meet the inpatient should be available. Standard 6 talks about adequate number of health professionals to provide proper treatment. So inpatients should be seen on regular basis by the mental health professional. There has to be a 24-hour availability of a medical officer to attend to the emergencies. Trained human resources in mental health for service provision. Specification of the human resource requirement as per the local resources by the respective government, and provisions for emergency treatment. That is, ambulance equipped with necessary medical equipment in all the mental health establishments. Standard 7 talks about engagement of medical and paramedical staff. So first is about checkup and treatment. So there has to be regular visits by a qualified medical practitioner as per the norms prepared by appropriate government. And engagement of the nurses should be in accordance with the norms set by the Indian Nursing Council. And multipurpose workers should be available, one for every 10 beds. And they should be employed after adequate induction training program. Standard 8 is about adequate floor space of the premise. So separate wards for male and female inpatients should be made available. Adequate space between the beds. And the ward bed and the surrounding space should not be within 1 meter on all sides. And adequate dimension to safe evacuation in case of emergencies. It also talks about common room which has television, newspapers, and indoor games, chairs in the ratio of 1:4. Both outpatient and inpatient facilities should be there. Sitting arrangements for all. Drinking water facility should be there. Registration, help and cash counters. Separate toilets for males and females. Standard 9 talks about equipment and articles to be procured in the mental health establishment. So medical equipments should be made available in accordance with the scope of the services and bed strength. And they have to be kept in good usable condition. Anesthesia equipment such as oxygen cylinders with flow meters in the mental health establishments providing electroconvulsive therapy. And basic equipment such as sufficient sets of blood pressure apparatus, stethoscope, weighing machine, thermometer, and other basic equipments should be made available. It also talks about sufficient stock of drugs, medical devices and consumables, first aid box with standard contents and daily check done for the replenishments, and an examination table with footstep. Standard 10 talks about alternate methods to be used in the place of restraints in crisis situations. So physical restraints should be used only to prevent inpatients from hurting themselves or others, with the permission of the consultant psychiatrist or the medical practitioner on duty. Circumstances to be recorded in a separate register that we had discussed earlier, also the forming. And the nursing staff has to be trained to use de-escalation techniques, and there should be adequate number of security guards, and they have to be equal in number in terms of having both male and female guards. Standard 11 is about protection of privacy, safety and security of patients, especially of women, and their confidentiality. So there has to be no discrimination on any grounds. And reasonable freedom and facility for pursuing religious beliefs should be made available. Physical examination or treatment of a female patient has to be done in the presence of a female, either the attendant or the nurse, if it is conducted by a male medical staff, and vice versa. And independent lockers for patients should be made available. Also, necessary procedures to meet emergencies in case of a fire or a non-fire emergency, and appropriate display of fire exit signage at least two languages, and one has to be in a local language. And all fire safety measures need to be taken, like prevention, detection, mitigation, evacuation, containment, and mock drills. And firefighting equipment has to be periodically inspected and replenished. Also, provision of clean undergarments and disposal of sanitary napkins, basic hygienic articles like slippers, towels, combs, bathing and washing soap on a fortnightly basis, and at least 2 shampoo sachets every week need to be made available. And basic cosmetics like powder, cream, bindis, kumkum, and others. Standard 12 talks about the provisions that are mentioned in the Right of Persons with Disability Act 2016, that every mental health establishment should comply with these norms which are available in the Act. Thank you.
Thank you, Dr. Bhavika, for the lucid presentation. Now, we'll go on to the question and answer session. Before that, I would want to tell everyone that we have presented only the regulations as it is. We are not discussing whether the regulations were right, wrong, how these were made, etc. This is only the regulations as gazetted. So now we'll take the questions. You can send the questions in the chat box or in the YouTube channel.
Okay, so starting the discussion, one of the question Dr. Bhavika usually they ask is, okay, we have got the minimum norms, like minimum standards of registration for mental health establishment, which has been there. Should it be, the question will be, should it be same for everything, or because there is no categorization of mental health establishment like the mental health hospital, general psychiatric establishment, rehabilitation center, there is no categorization. So how it will be done, Dr. Bhavika? Any idea?
Sir, what I think is then the state rules would come into how each and every state decided their particular in the region based on their resources facility. So I think one thing would be that the state would decide.
Okay. So obviously there are two possibilities, Dr. Bhavika, what you mentioned. So one is either it can come in the state rules or else in the state regulations. So because state mental health regulations also plays a role. So invariably there are a couple of states have formed the what we call it as the regulations for state establishments, that is state mental health establishments. However, there is a discussion to be having a various categories of mental health establishment. It could not happen till now, but it will be done shortly with regard to central mental health establishments, the establishment which come under CME, that is Central Mental Health Authority, sorry. So that will be done. So there is one question somebody, I think Vishalakshi madam has asked, are there any specific norms for MHEs to run by NGO? That is the question.
Yes, so the mental health establishment norms which are provided are for all the establishments, irrespective of whether it is state-run, it's private, or run by an NGO. So there are no specific norms for the NGO person. Also, what is the process registration for NGO functioning as MHEs? It's the same as we have described. There is no separate registration.
Yeah. So if I'll slightly go back, what Dr. Bhavika has added, I'll add this. There was a different category of MHEs were submitted a long back, but the committee formed decided we will have a minimum norms in the CMHA, and later we can think of having the mental health establishment related minimum norms. That's the way it was decided. So we have minimum norms as a whole. Complete, because if you look at supported accommodation or sheltered accommodation which come under the rules which doesn't require ECT requirement, that is having Boyle's machine, having ECT, all those is not required actually, if you ask me personally. But however, in the minimum norms they are kept, but when the categorization of the MHE is done, there it can be taken care at the individual level, at the SMHA, State Mental Authority. But however, Chhattisgarh has formed their State Mental Health Authority along with the rules. They have already notified the each minimum norms for the categorization has been done. It is yet to be approved by the central government. Once it is approved, it will be available for everyone. So there, yes, the categorization has been done. Out of this 12 standards for acute care, what should be there, whether there should be 12 plus, because here if you look at the minimum norms, there is no requirement of resources has been told, especially with regard to human resources. How many psychiatrists should be there, how many psychologists or clinical psychologists, psychiatric social worker. So invariably it is left to the state mental authority to decide. So that's how it has been discussed. So that's the way it will be considered. I think Umesh Nagarpurkar sir has asked, in psychiatric rehab or de-addiction center setup, psychiatrist presence is mandatory, is the question asked. So how would you like to respond, Dr. Bhavika?
Yes, sir. So basically what is that for any center, they have not really which staff need to be. I think that the rules part, not in the record.
Yeah, I will respond to it, Bhavika. See, if it is a de-addiction center, if it is acute care center, where we are going to keep ICU for the de-addiction center, acute care for withdrawal, definitely there is a requirement of a psychiatrist. Or if it is a long-term de-addiction care where we are not going to keep acute care, invariably it will be discussed in the state mental authority or state mental health regulation or in the state rules. That is the way it will be taken care. Otherwise, as a long-term psychiatric rehab, 24/7 is not required. However, now the telepsychiatry is available. How it will be incorporated in the state rules and the state regulations will play an important role, because 24/7 psychiatrist can give even the opinion on telepsychiatry. So that would be one we need to take into consideration most probably. So any other questions?
So there is one question. Psychiatric patients presenting with medical illness, which can be managed in MHE, can be admitted or has to be taken to the medical unit. So I would respond to this saying that it would depend on the discretion of the doctor. They have the facility to manage the issues, then they can very well do health establishment. Otherwise, they might want to transfer it to
Okay, Suvendu Mishra, I think from Orissa has requested, if state mental authority is not formed, whom to apply? So invariably, if the state mental authority is not formed, if you ask me, the previous Mental Health Care Act, under that, whatever the SMHA is there, that continues to exist. As per the MHCA 2017, it clearly says, whichever SMHA is there previously, that will come into picture. So invariably that has to be considered, and that SMHA will function until the new legislation is found. But however, the legislation MHCA also clearly says that within a period of so many months, the MHCA is enforceable. That means it has to be in action. That's the way it is there. But however, a couple of PAL is pending. So invariably, depending upon each states, they will take it up and they will consider. Chetan, you can read the questions because Bhavika has some internet problems. Yeah.
Dr. Khalil Mukhtar has asked, sir, does the building have to be separate, or it can be part of a big building, which is a hospital? A floor of the building can be a mental health establishment.
Okay, this is a very tricky question which has been discussed very in detail in the meeting, because if you are going to have it in the same structure, invariably it will be considered under as a acute care. Because invariably you can't have two rooms. I will say half of the building is acute care and half. That means you will apply two registration then. It can't be. Single registration is MHE, mental health establishment. For see how the categorization is done. And if you are going to club two institutions, maybe acute care plus rehab, then people will say the acute care is how much is required, how would you divide? Because it will be two separate registration invariably. So if you are able to show differently or the same, it's a very tricky question, and seriously, I don't know how each state will decide about this. Dr. Shivgatam sir is there. I would like to ask his opinion. Dr. Shivgatam sir, please. Sir, unmute, sir. Dr. Shivgatam sir is our senior colleague and also Niman's alumni. Sir, please go ahead, sir. Can you unmute? Dr. Chetan, can you unmute Dr. Shivgatam sir? Yes, sir. Please go ahead, sir.
Can you hear me?
Yes, sir. Yes, sir. Please go ahead, sir.
Yes, thank you very much, Suresh. In fact, I was interested in this topic because I was a part of the National Human Rights Commission Quality Assurance in Mental Health document, which was published by NIMHANS long back. And what exactly is the status of the present presentation which you have made? She has done it very well, but there are some issues like the physical structure of the building. There were a lot of controversies, and one of them has been already pointed out that people, especially in the cosmopolitan cities, they have one building and then taken one floor of the mental health establishment, building. Now, the state government has given, I've seen in Ahmedabad, I've seen in Mumbai, and I have seen mental health establishments running in a small 3-room flat, So it's a very tricky issue because the space which has been provided for the OPD is far less than sufficient. So that is one issue. Second, if you have gone through your presentation, I'm asking the lady presented the presentation. Is it based on the Mental Health Act of the 2017, or it is based on the NHRC document? That is it at par with the NHRC document? That was my question which I had registered there.
Okay, sir, I'll respond on behalf of her, sir. It is based on the CMHA regulations, which took into account of NHRC's guidelines and also Supreme Court's decision, various decision which has come up. On that basis, one of the committee subgroup came up with this minimum norm, sir.
Where is this document available, Suresh, now?
See, it is available in public domain. I'll be able to send you personally, sir, to you.
Thank you very much.
CMHA regulations notified on 18th December 2020, sir.
Okay. So that would be very nice to have them. Second issue is related to the rehab centers. You have made it very clear that long-term rehab centers, psychiatrist requirement visits once or twice a week should be sufficient. But many a times it happens that the patient, as soon as he is admitted in acute withdrawal state, then psychiatrist's presence is very essential, and at times medical opinion is also required if there is a hepatic involvement or renal involvement and so on. So we should have a battery of tests for all the patients admitted even in the rehab centers, especially if you look at the hepatic parameters, kidney functions and so on, so that we are sure from a medical point of view that or the treating psychiatrist is also safe if it comes to a legal action. That is my point.
Thank you, sir. Thank you. Chetan, can you go ahead with the questions?
Sir, Dr. Anup Augustine has asked, if a person is referred to a specialized COVID psychiatry unit by district medical officer saying he is not following COVID protocol, any possibility of admission against this will, even if capacity is intact?
This is a very difficult question to answer. Seriously, I don't know. This is outside the purview of CMHA regulations discussion. If a person is not following the protocol of the COVID and he has capacity, whatever the rules apply to you and me will be applicable to him. That's the best answer I can think of legally.
Yeah, probably because the Epidemics Act is in picture, comes to picture. So that will take precedence in such cases, I think.
Yeah.
Sir, the next question is by Charanpreet Singh. Are these minimum standards applicable to OPD settings also? Means not only OPD setting center needs OPD settings also need to apply for license under MHCA.
Yeah, see, it's very clear. There is no requirement of licensing or registration for OPD, but they have requested to have in the minimum norm certain minimum things, having, I think, water and waiting place. And I think even the urinals has been mentioned, which has been not from, it has not been taken because of this, because it's a Supreme Court decision is there in one of them. From there, they have taken. So in that way, it has been there. And actually, it was raised. Why, if when there is no registration required, why should we do? Then the chairman of the committee clearly said that registration is different, requirement is different. So we will ask them to have these minimum things to have a OPD. That's what the response came from. So any other questions are there, Chetan?
No, sir. Currently, there are no questions.
So, Shugautam sir, would you like to add anything else?
I think it has been presented well, and I congratulate your senior resident Bhavika for this presentation. On the 12th of June, Dr. Ramgulam from Indore, he called me and he said he wants to have a workshop on the private and government mental health establishments under the auspices of mental hospitals committee. I just wanted to tell because this is an interesting 12th of June is being planned, and I look forward to your presence and comments.
Definitely, sir. Definitely will be there, sir. And one of the questions today I got on email, I think Dr. Reddy sir from Shrikant Reddy from I think Hyderabad requested. This is nothing to do with CMHA and also the minimum norms. He asked, suppose somebody is admitted under section 89. Okay, 30 days is over. And we are shifting him to 90. So under section 90, whether this 30-day includes and goes for 60 days extra or separate 90 days. That was the first question he asked. Second question, even after 90 days of improved, there is no improvement. Immediately it is 120 days will be given or extended for another 30 days by 120 days. And next it is 180 days. So how it will be calculated is one of the question. So it was all, for me also it was very interesting. I went back to the MHCA, looked into 89 and 90. 89 is very clear. Any admission, involuntary admission, that is supported admission, requires first 30 days. And within 30 days is getting expired, you will apply for 90. So under section 90, you will get extra 90 days. That is 30 plus 90. So after, at the end of the 90 days also, you find that is no improvement. You can ask for extension for another 30 days. And after 120 days, if there is no improvement, you can shift it to 180 days. Every time 180 days can be asked. So that is the way it goes. 30, 90, and then another 30 extra will be given. Extend, that is the word is used, can be extended up to 120 days. Then afterwards, 180 every time. That is the way it has been documented or been written. That is how I would like to interpret from my opinion, reading the legislation. And Rajesh Nair sir, as I think the last question, can we get the link to the Central Mental Health Establishment Act? This is basically, Rajesh Nair sir, I'll be sending I tried to send the CMHA regulations here, but I could not send it. Is it possible, Chetan, can it be sent here to everyone?
Yes, sir. I'll send it.
So now in the chat box, it will...
One last...
Yeah, go ahead. Yes, sir, please go ahead.
Regarding the architecture of the mental health establishment, a practical issue which comes many a time, which we found a solution, which I'll let you know, that patient closes from inside, he puts a latch. And if sometimes there is a serious issue regarding a suicidal attempt or patient's threatening behavior and so on. So what we have done in our private establishment is that we have removed all the procedures to close the room from inside, and it can be only done from outside. There is another way of architecture being that you can insert something through the hole in the gate and open the door in case of emergency.
Okay.
So what is your, it's an architectural issue.
Yes, sir.
What is your view?
Sir, actually, with regard to fire norms, recently, after a couple of fire tragedies, there has been a notification from the central government regarding how the public establishment, nothing to do with public health or health, it is all public establishment where patients are kept. There should be a separate exit apart from the main exit.
The exit of the hospital is fine.
Yes, sir.
The exit of that particular room where the patient is threatening you and he is saying that I'll commit suicide. There is a fan inside and I have the dhoti or whatever cloth it is there. Okay. And he doesn't open the room. What do you do?
So inside, if he is locking, invariably what they have done, in our demands, what we have done is every, these kinds of rooms, all locks, everything has been removed. So even
from inside.
It's inside, even the locks from inside, even the toilet, because in Niman, sir, what is happening was majority of the time the suicide used to occur in the toilet. Even the toilet latches have been removed. So whenever there is a doubt, they can push even the bathrooms.
Then the question of privacy comes in.
No, he can push the door, but he can't lock it.
Absolutely.
So that's the way they have done, sir. I think you have mentioned clearly the same thing is happening here also. So invariably, those kinds of minor modification can be done.
What we have done is we have put a hole in the main door of the room.
Okay.
And the latch can be opened through a small road from outside.
Okay, sir.
So in case of emergency. So there are small things which will come in as we work.
True, sir. True, sir.
Okay.
Sir, thank you, sir. Yeah.
Thank you, sir. Sir, there is one question from Mr. Nataraj. I don't know whether it comes under the purview of this presentation. What about caregivers?
Caregivers means most probably he's mentioning about what about caregivers means?
Yes, sir. In the Central Mental Health Authority, is it not taking? It is not talking about whole of caregivers.
Yeah, obviously, if you look at the whole legislation as MHCA 2017, the caregiver is a nominated representative. That is the way it has been taken. NR, if there is no nomination, the caregiver comes as a third person. So, or the family member. So, invariably, the Mental Health Care Act revolves around the liberty of a person with mental illness. Unfortunately, it has moved away from the family concept, or else caregiver concept has moved away, because the whole act believes that either the caregiver or the professional or the society is abusing their rights. That is the way it has been drafted. So unfortunately, over a period of time, it requires the caregivers association, family members association to consider to go to maybe a PIL telling that my patient is refusing to take medication or is writing somebody else as a NR. They have to approach. As a professional, we may not be able to do much because it will be considered as conflict of interest. So invariably, the Parents Association, Caregivers Association should take up, which has been already been seen in US. If you look at the US, the way it has happened, if you look at the Kendras law, that is in New York, what has happened is a person with mental illness pushed a young lady journalist in front of a train. He was mentally ill, he was not taking medication. So Kendra's family and the Families Association went to court and asked for compulsory treatment order, that is CTO. So invariably, that is the way the law evolves when the law is being made centric around the patient. So obviously, the family members have to go. I personally believe that family members who are providing care should also get pensions for the caregiver pension, which is there again in Western concept. Because imagine if a person with mental illness, who has disability, who has high needs, which is there under RPWD Act, disability with high needs, that means a person completely devotes his life to looking after them. Imagine a person with resistant schizophrenia. He's responded only 50%. A family member has to be there to provide food, provide care. That kind of situation, I think there is a scope for caregivers pension. That is my personal opinion. I don't know if the Caregivers Association are able to move forward and ask for it. I think there is a scope. It can be done. So that is my personal opinion. And I would definitely support that kind of this one. And also Prerna has asked one question, whether e-Manas can be implemented across the country. Because in Karnataka, the e-Manas is running smoothly with regard to registration of mental health professionals. MHEs have started slowly. So it is taken up. Because of the COVID, it has been lagged behind. But however, the IIITB is the engineering college, or basically one of the autonomous institute, which works with the private industry and also the government. is continuously modifying the e-Manas. So we are almost finishing the MHE requirement of OPD registration, OPD, the minimum basic medical records. That also is integrated slowly. And recently it has been released in one of our meeting by the health secretary. So slowly it is getting upgraded. If the central mental health authority would like to take it up and discuss with the Karnatakas, because now the whole amount was paid by the Karnataka state government. It was the intellectual support was given by NIMANS and the triple ITB built it. So triple ITB is a international Indian technical educational center basically. So invariably the Karnataka state government has to give permission, and if they are able to, Maharashtra has asked, I think Maharashtra, Karnataka, and I think one more state has asked for it. If the CMHA asks, most probably with the Karnataka state government, it can be doable across the country. So it will be easy for reporting and MHRB working, all those things can be done.
So Dr. Rakesh asks, is it necessary to have, say, for example, Bombay nursing home registration along with psychiatric nursing home, or only psychiatric nursing home registration is sufficient? So, for example, private medical establishments. So, if a person has inpatient facility, do they have to register in both the state's private medical establishment act and also the mental health care act?
So invariably, the central, if you look at the Mental Health Act, it clearly says if you have already registered under various legislation, or maybe even in the Clinical Establishment Act or establishment, you send a copy of it, and if the state rule says that you have to pay money, 25,000, you have to pay. If it says if you have already registered, need not, so that is the way the state rules, how it will be written. These are the small modifications to be done in the state rules. This is Rajesh Nair has sent some simplified.com. This is, yeah, sir, you are requesting for the regulation. Rajesh Nair sir has put the link for the regulations. Everybody can click on it. Rajesh Nair has, thank you, Dr. Rajesh Nair. He has put the link for the central mental health regulations, which was recently notified, is available now. So everybody can download from the link. And even Dr. Chetan also has sent the PDF link. So, yeah, any other questions left behind?
Can you send it to our email address?
Yeah, sure, sir, sure.
Thank you.
Chetan, this can be sent to the people who have registered with their email.
Yes, sir.
Or maybe we'll send you the email address.
Sure, sir, definitely. Or else I'll be sending in various WhatsApp group telling that these are the CMHA regulations, which was recently asked. Thank you very much, Bhavika, for your wonderful presentation. And Dr. I would thank our senior sir who participated and clarified many of our questions, because he is running various, Shiv sir is running even the acute care center and rehabilitation center, and he is also part of the NHRC, and he is also working for in the state of Rajasthan with regard to SMHA. Thank you very much, sir. Over to you, Dr. Chetan, for the...
Thank you, everyone, for attending today's help session on Central Mental Health Regulations of 2020. We will be conducting many help sessions. We are planning to conduct it every month on a Wednesday. We'll let you know in our various WhatsApp groups and widely circulated beforehand. So this has been running from past three, four sessions have happened. All of them are available in our YouTube channel, Telemedicine Center NIMHANS. So please subscribe to our channel, and you will be able to get notifications to all these help sessions. Not only these help sessions, but also various activities taken by Telemedicine Center NIMHANS. You will get the notifications. So kindly subscribe to our channel. And I sincerely thank Dr. Bhavika and Dr. Suresh Badamat sir for their presentation and clarification of the doubts. So thank you, everyone, for attending today's session. We'll call it a day. Stay safe. Take care. Thank you.
Thank you.